I was given this topic, the use of data and advocacy, and so there's a lot of data, and so I am going to run through the slides because there's lots of numbers, and I don't expect anyone to remember all of these numbers. So the objectives of the talk is the use of data when advocating to different groups, gathering local data, which is what we have done in Hawaii, and a first analysis of our Hawaii COPD Coalition data from 2010 to 2011. So I love this. In God we trust, all others must provide data. So I have done advocacy in Washington, D.C. I'll be going there next month with the American Thoracic Society. And so what do you tell people? I think your message should be brief. You can tell them COPD is the third leading cause of death now. Death from COPD is increasing. Death from heart cancer and stroke is decreasing, as we've heard earlier. Tell them the scope of the problem. The prevalence of COPD, if you go by ATS, is 2.9% of the population. If you go by GOLD, it's 13.9%. GOLD is industry sponsored. We don't know which of these are up. The two numbers are obviously very different. What is the risk? This article appeared recently. It's the first to determine the lifetime risk of COPD, which is 1 in 4. Now that's phenomenal. This study was done in Canada. It was published in The Lancet in September. It was the first estimate, as I said. They found that COPD was associated with lower socioeconomic status, that 75% was caused by smoking, and that the risk of COPD was 2 times that of heart failure, 3 times that of MI, breast cancer, and prostate cancer. What's very sad, as you all know, is many of these other conditions, while important, do not cause nearly the amount of death of COPD, and yet the number of dollars spent on research is tremendously higher. What about disease detection? Well, we know that spirometry is easy, it's affordable, it's effective, it's objective, and early detection is really the one thing we can do to prevent further progression of COPD. In 2008, it was estimated there were 13 million adults with COPD. However, there were 24 million people with impaired lung function. And this really indicates probably an underdiagnosis. I was heavily involved with quality. I was the head of quality for Kaiser Permanente Hawaii. And as such was involved with NCQA, the National Committee for Quality Assurance. This is something that all medical programs have to do, and HEDIS, which is the Healthcare Effectiveness Data and Information Set, is something that hospitals and clinics must report. And there was added a COPD measure, which is the percent of adults greater than 40 with a new diagnosis of COPD who had spirometry done. So what they're trying to say is, okay, if you're going to diagnose COPD, you better have an objective measurement of that disease. After all, if you diagnose hypertension, you have a blood pressure, right? Would your doctor ever treat blood pressure without checking it? No. Yet many patients with COPD are diagnosed and treated without ever having spirometry. So from 2006 to 2011, because of this measure, there was improvement in the commercial Medicare and Medicare rates in this measure from 31% to 41%. It varied. Now I can tell you in Hawaii, when I was at Kaiser Permanente, our rate was about 25%. We had much more control over our doctors, and our last rates were over 40%. Which were the highest in Hawaii, but clearly nowhere near the rates of other measures like mammography, colon cancer screening, etc., that all are upwards of 80 and 90%. In national advocacy, which I do, you visit your senator or representative. You're important if you are their constituent. You'll find out that Washington is run by 20-something-year-olds. You will never see, or you'll be very lucky if you ever see that representative or senator. You will be greeted by some 23, 24-year-old. So please have printed material to leave with them and write or email a thank you note to remind them of your visit. You can do state advocacy. Hawaii COPD Coalition does this. And if you do, use data that is pertinent to your state, your city, or your district, following the same guidelines. Bring a patient. A patient makes a big difference. I do advocacy with American Thoracic Society in Washington, D.C. We always have a patient. Everybody that goes to visit a senator or representative has a patient with them. BRFS, you probably have never heard of this, but it's called the Behavioral Risk Factor Surveillance System. It's the largest continuously conducted telephone health survey in the world. All states, including California and Hawaii, have participated since 1988. In 2008, Hawaii paid to add a question on this test of this surveillance system of self-reported doctor-diagnosed COPD so that we could have some data pertinent to Hawaii. There are other sources of national data that are available to you. You can go to NHANES, which is the National Health and Nutrition Examination Survey. This involves interviews, spirometry, and a physical. NHIS, which is national self-reported data. And obviously there's need for expansion and adaptation of these surveys so that they do include COPD. So they do include questions about lung health. In Hawaii, we also have the Hawaii Health Survey. We're one of the few states to have a population-based estimate of health and demographics. It was first conducted in 1968 in person. In 1996, they started doing this by telephone. And in 2007, we added a question about doctor or medical professional diagnosed COPD. So you call a household, and whoever answers the phone is then asked to report on every member of that household. As a result of this, in 2010, this report was published, The Burden of COPD in Hawaii. This was based on the 2008 BRFSS and the 2007 Hawaii Health Survey. What we found was 3.2% or 2.2%, depending which survey, of people surveyed in Hawaii had doctor-diagnosed COPD. The prevalence was highest among the unemployed, the unable to work, and those whose income was less than $15,000. 27.1% of current smokers versus only 15.1% of those without COPD. 27% were current smokers of those with COPD. And 1/3 of the adults with COPD never smoked. I actually went back and double-checked that because I found that rather amazing. Yes.
Something's happening in Hawaii.
How about smoking in Hawaii? Our overall smoking rate is not too bad, not as good as California. 15.4%, but as you can see, it has decreased. So we are making progress. Current smokers are 3.4 times more likely to report COPD, and former smokers are 2.8 times more likely to report COPD. So again, smoking is very important.
Not smoking.
You can talk about economics and numbers. In 2008 in Hawaii, there were almost 1,600 hospitalizations. Average length of stay was 5 days. Average cost was $20,000. The cost per day per discharge almost doubled in the last 10 years. We all know how the healthcare costs in this country in general are rising tremendously. Charges, this is just in Hawaii, you can imagine what it'd be for California. For the ER were $3 million and $23 million for those who admitted. Hawaii has been making some progress in anti-tobacco measures. This was a report just last month from the American Lung Association. We're one of only 4 states to make progress in our overall effort to curb tobacco-related illness. There were estimated nearly 1,200 deaths. Our rate of smoking in the middle school was 4.9%, rather remarkable. In high school, 15.2%, and in adults, 14.5%. Our tobacco settlement funds, most tobacco settlement funds in many states have been appropriated for roads and other things. We still get some money, but every year it's a huge fight in the legislature to keep getting some money, and it's decreased over time, as you can see. So the Hawaii COPD Coalition Clinics, as you heard from Valerie, started in 2008. Initial data, unfortunately, is available to us only in summary, but in 2010 we started gathering our own data, and I have looked at it recently. So in 2010 we did 582 surveys. People who came to these clinics had their blood pressure checked, their height, spirometry, counseling, smoking cessation counseling if pertinent, and referral to resources. So the number of smokers, 74 of these, or 13%, were smokers, similar but less than the BRFSS, and former smokers were 21%. This is very sad. Those who previously received cessation counseling was only 6 out of the 74 that answered this question, and those who knew quit smoking resources at all were only 27%. Of those who had spirometry, 27% had a diagnosis of COPD. This is much higher than the 2 to 3% of the state surveys. And 16% had a previous breathing test. So obviously many patients were diagnosed with COPD, but not as many had a breathing test. We looked at those patients, 138 of them, who had a FEV1 less than 75%. Abnormal is considered less than 80%. This number was chosen to be slightly more stringent. Of these, 35.5% had already a diagnosis of COPD or asthma. 23% only had a previous breathing test, and 37% were current or former smokers. So you can see there were a large number of these people that were screened who had never smoked. Of those who already had a diagnosis of asthma and COPD, only 34% had had a previous breathing test. 31% of these had a FEV1 less than 75%. And 20% of people without asthma or COPD had an FEV1 less than 75%. Again, showing that although you must pay attention to smokers, you also need to pay attention to non-smokers. In 2011, with more clinics, we reached many more people, 1,264 surveys. Some are incomplete. Again, we did the same things as in the first survey, in the first clinics. So in 2011, 13% were smokers, identical to 2010. The number of former smokers, that should be 18%, was less than 2010. Unfortunately, I cannot tell you who received previous cessation counseling or new quit smoking resources because that question was not repeated on the questionnaire. Going to spirometry, 27% had a previous diagnosis of COPD or asthma, again, identical to 2010. And 16% had had a previous breathing test, again, identical to 2010. Of the 293 patients who had an FEV1 less than or equal to 75%, 37% already had a diagnosis of COPD or asthma. This is higher than in 2010. 21% had a breathing test, which is lower, so we're not making any progress in getting physicians to do spirometry. and 34.8% were current or former smokers, again, lower. Of those who already had a diagnosis of asthma or COPD, 31% had had a breathing test, 44% had a FEV1 that was abnormal, less than or equal to 75%, but again, 20% without asthma or COPD had an abnormal FEV1. Again, a significant number of patients without that diagnosis had an abnormal spirometry. Conclusions, there is a lot of national as well as state data available, so use it. I mentioned the national surveys that are state specific, that are available to all of you. Add questions to the survey in your area relative to smoking, COPD, and lung health. And I understand from Neil that you will be adding a question for California to the BRFSS survey. Collect your own data if possible. Our data analysis is still not complete. There is still much for all of us to do. Thank you very much.